I had a question, fascinating talk. I had a question for Dr. Bushart off the. So,
Okay.
Oh, okay. How do we? I love the idea of being able to analyze food and getting a lot tighter in terms of what the food is providing. I just want some thoughts in terms of sort of practicalities, how that could be brought forward commercially, right? Because I mean, it's impractical, I think, for every company on every food to be looking at integration of multiple food-based metabolomes. So how, what are your thoughts on maybe some places where there could be indicator biomarkers and how that could be done in sort of a accessible, affordable way?
One of the things that Susan mentioned actually is a kit. It's called the Biocrates kit that allows people to do targeted metabolomics. And more, in fact, groups and other companies are starting to make kits for standard targeted quantitative analyses. Our group is working on an exposome kit, and it's primarily targeted, for instance, not so much for food analysis, but for food biomarkers. Now, the same thing could be done for specific foods and ones where are of particular interest, either for nutrition or micronutrient values. The nice thing about the kits is that they are absolutely quantitative, they are reproducible, they're consistent with one instrument across or multiple instruments. So for companies, I think those would be ideal. One of the things that Susan mentioned actually is a kit. It's called the Biocrates kit that allows people to do targeted metabolomics. And more, in fact, groups and other companies are starting to make kits for standard targeted quantitative analyses. Our group is working on an exposome kit, and it's primarily targeted, for instance, not so much for food analysis, but for food biomarkers. Now, the same thing could be done for specific foods and ones where are of particular interest, either for nutrition or micronutrient values. The nice thing about the kits is that they are absolutely quantitative, they are reproducible, they're consistent with one instrument across or multiple instruments. So for companies, I think those would be ideal, and they could be, reproducible, consistent. You could perform the tests over and over again. They have, GLP, GMP certification. So I think that's a way of going forward with that type of measurement.
Chuck Barton, Valspar Corporation. Thank you, Susan, for a very interesting talk. I'm curious as to the role of the microbiome potentially. Your research is focused on, for example, in choline, and we know that the microbiome plays a prevalent role in choline metabolism. And when you looked at the hind children, there were two metabolites that were identified associated with autism. One of them being DHA, which again, the microbiome has been shown to play a role. And looking at phthalates, your research is everywhere, but yeah. You've also looked at phthalates and looking at neurobehavioral effects. And there's always been a question as to, and from a toxicology perspective, mechanism. Is there a non-endocrine mechanism involved? And so one of the things that I'm curious is that could chemicals, it's never really been hypothesized, but could they be acting by influencing the microbiome, which in turn affects chemistry?
Yeah, I think it's definitely possible that the nutritional exposure or chemicals that are unintentionally introduced in the diet could perturb your microbiome, and that could be related to some of the metabolic perturbations that we see. Just like in the case of the antibiotic, you could think of that as being, instead of an antibiotic, environmentally relevant chemical. We know it perturbs the microbiome, and we see similar types of pathway perturbations in our metabolomics analysis.
One more, looking at
But-
the interpretation of, just thinking about DHA and autism, because that was fascinating, and also thinking about metabolism with it. Do you think that gives an idea into how we could treat autism?
So I'm not a medical doctor. I am a physical chemist, so I don't want to give any advice on treatment. But I did learn during the process of doing that study that DHA is used sometimes in the U.S. in supplementation. And so I asked specifically to the investigators involved and they said it's not used in this Chinese Han population. So the fact that it was decreased, I think, was pretty important, because in the U.S. there are a lot of people who use the DHA supplement with autism. So maybe that's supportive of that, right, of that use. Now, for the other compounds, the way that we're looking at those is, can we go into animal models now that have behavioral phenotypes that are associated with autism, and see if any of the other ones that are used it could be used as supplements in the diet to reduce some of those behavioral phenotypes. So sort of goes both ways.
Thank you.
I have a question for Susan. So when you're looking at neonatal model, what is the best tissue extract to use when you're trying to look at the influence of nutrition? Would that be the placenta, or would that be the embryonic fluid?
So I think it depends a lot on the question. So, of course, anytime you want an early biomarker, you may even want to look at the mother's serum before, in her first trimester of pregnancy, or if you could even look pre-conception in the mother and father and see if there's a correlation with something that happens with that baby. And, NIHS has this big program now. It's the Children's Health Exposure Analysis program, and then they have a program called ECHO, which is really trying to do that, is look through the life stages and see what's later in life. By the time you get to the placenta abruption and you're looking at the placenta, well, maybe that could give you some ideas about, the stress that's happening at the time of the abruption, but it probably isn't going to help us as much about trying to get an intervention early on. So I think the earlier, typically the better for trying to get that intervention idea in place. But it really is, what are the study questions? Yeah.
Michael McBurney, DSM. Appreciated both talks. This question's really for Dr. Wishart. And looking at all of those, thinking about the Alberta food composition table, I know that in macronutrients there's a lot of variability from season to season in terms of where it's being grown. Can you give me some sense of what the variability and the application of having a data set that's specific to a sample could be?
Yeah, certainly there is quite a bit of variability, and that's partly what pushed us to gather not only our own experimental data, but also to collect stuff that has been published in different areas and from different varietals and different soil conditions in Europe and the US and elsewhere in Canada. We were a little surprised that there wasn't as much variability as we expected when we compared things across studies. I mean, there are some compounds that vary, but I was surprised by the consistency, more so with the micronutrients. And certainly there was a fair bit of variability, I think, at the sugars, I think, was what we saw the biggest variation in with fruits and vegetables.
Do you see it being used as a way for traceability or some application in that sense?
So the particular interest that we got when we initially proposed this was the producers are interested, the farmers are interested, as a way of differentiating their crops or products from other products. So in Alberta, again, the climate does lead to some higher values for certain compounds, for some micronutrients, and they wanted to use that as sort of a labeling advantage, and to use that as saying, our asparagus has, higher amounts of X or Y. Those are, in some cases, those things were known and we confirmed them, and in other cases, there's some new things found. I think it would be hard for traceability overall, I think. So it was done more from, I think, the angle of differentiating, but also to try and get a readout on micronutrients, which historically has not been tracked very well with food analysis.
All right.
Okay.
Well, thank you. Thanks to Dr. Sumner and Dr. Wishart. And